Namaskar. I welcome you to the second episode of Diamonds Are Forever. Today we bring you another diamond from the 1950s. In that era, obstetric practice was very different. Being an obstetrician meant being very patient. There were dictums like never let the sun set twice on a laboring woman. Often long trials were given and the patient landed up with a cesarean section, which was the last resort pretty late. And at cesarean section, then you had to deal with a very deeply impacted fetal head. So to deal with this particular problem, we have Dr. Balchandra Patwardhan, who described a unique technique of delivering the fetus safely and relatively easily compared to the push method, which from down, which was the technique generally used, and in fact, which is the technique generally used in the West even now. So, what is Patwardhan's maneuver, and how far it has progressed from the 1950s to today? Let us have a look in this episode. As my co-host today, I have Dr. Parag Binniwale, who's assisting me with this episode. And he is going to describe first the Patwardhan's maneuver to you and show you small video clips about it. Then we will undergo and review the literature which is there on Patwardhans in India. And after that, we will go to the UK and the US of A and see what is the uptake of Patwardhans there. So let me introduce Dr. Parag Binniwale. He is also the vice chairman of ICOG with me as chairman. And over to you, Parag.
Thank you, Uday. I'm going to describe the Patwardhan's maneuver, which was originally described in the year 1957 by Dr. B.D. Patwardhan. He was working as honorary visiting obstetrician at the prestigious Nauroji Wadia Maternity Hospital in Mumbai, and he wrote this paper in the Journal of OBGYN of India in the year 1957. The study which he conducted was done between 1950 and 1954 at the Wadia Maternity Hospital. The cesarean section rate at that time was 1.49%. So total 85 women were included in the study who had undergone delivery of the baby by the shoulder technique. And Dr. Patwardhan quotes that only on 2 occasions in 1952 there was an extension of the incision, but otherwise delivery of the baby was safe and the mother was also safe throughout the procedure. And Dr. Patwardhan says, and I quote, "We can emphatically mention that several more infants have been extracted by this method in 1955 and 1956, and on no occasion has injury occurred to the fetus." I unquote. Dr. Patwardhan described 2 methods. Firstly, when the back is posterior. Now, if the position of the back is posterior, the first thing that we do is deliver one shoulder. Since there is enough space, the hand is introduced to the fundus and the leg is caught and gently pulled out. Thus, the breech and the trunk is delivered. At the same time, the assistant presses the fundus to help the delivery of the breech. And after the breech is delivered, the head comes out very easily with delivery of second shoulder. If the position of the baby's back is anterior, one shoulder which pops out of the incision is delivered, followed by the second shoulder. The 2 fingers, that is the index finger and the middle fingers, are introduced on both sides of the chest of the baby, and the flexion of the trunk is done. So thus the baby's trunk and the buttocks are delivered. The assistant presses at the fundus, thus chest, abdomen and breech are delivered successively, and after that the head comes out very easily by lifting the baby by the legs. The advantages of Patwardhan's method are: a trial of labor can be given for a longer time if maternal and fetal conditions are satisfactory. There is no extension of the incision at the time of delivery, no injury to the baby, no increase in fetal mortality, and no increase in maternal mortality and morbidity. These are some of the important observations of this study. It is a much cleaner procedure than asking an assistant to push up the head per vaginum. There is still a possible risk of lateral extension, but it is reiterated that the method is by no means a routine procedure. It is recommended only in the difficult cases where cesarean section is done with the head low down in the pelvis.
Thank you, Parag, for that lovely explanation of the procedure and a detailed explanation. So let me tell you a little bit more about Dr. Balchandra D. Patwardhan. He was born on the 22nd of January 1900 in Akola, district of Vidarbha. He did his school in Akola. His father was a tehsildar. He came to Bombay for higher education and joined the Grand Medical College for MBBS. He later did his MD from the KEM Hospital and GS Medical College. He was attached to Grand Medical College and JJ Group of Hospitals and retired as a professor in HOD of Obstetrics and Gynecology. He was also an honorary consultant at the Navroji Wadia Maternity Hospital and Bombay Hospital. He had his private hospital in Girgaon, Mumbai, which he started in 1931 and practiced there till his retirement in 1976. He was academically inclined and was the president of the Bombay Obstetric and Gynec Society in the year 1958 to 1960, which was also the silver jubilee year of BOGS. Let us know him a little more personally through his daughter and granddaughter. So let me introduce you to Dr. Patwardhan's daughter, Dr. Medha Patankar, who is a renowned gynecologist in Pune city and was a professor at the BJ Medical College in Pune, and her daughter, Dr. Vaishali Binewale, who is a practicing OBGYN in Pune. So Dr. Medha, how could you tell us a little bit more about your father, his personality, what sort of a person he was, and what memories you have of him?
Right. Thank you, Dr. Uday Thanawala. I, Dr. Medha Arvind Patankar, is the second daughter of Dr. B.D. Patwardhan. We were 5 brothers and sisters, and we were all highly educated. My eldest brother, Dr. Vasant Patwardhan, and myself continued our father's passion and legacy in obstetrics and gynecology. Vasant practiced in Girgaon. He had great interest in academics. He was a president of Bombay OBGYN Society in the year 83-84, which happened to be a golden jubilee year. He was a president of Foxy in the year 1993-94. My father's legacy is continued in our next generation. My daughter, son, daughter-in-law, and son-in-law all are consultant gynecologists. My father was very strict, but very, very affectionate. He was very particular about our studies. The morning in the house always started with few hours at study table, where even a milk glass was served at the table. As a doctor, he was a great surgeon. He used to operate very meticulously and neatly. His students learned how to respect tissues during surgery. He used to operate with precision. He believed that surgical techniques should be so accurate that you don't need to repeat any step during surgery. He expected all his students to have a clear understanding of pelvic anatomy. He wanted all his students, even undergraduates, to learn all age-old conservative treatments which are life-saving, like uterine packing for PPH As a doctor, he was a very compassionate person. He was extremely tolerant to the patients and was a very good listener. He worked in an era where operative obstetrics and anesthesia was not so safe as of now. Giving prolonged trials of labor was very common. This resulted in many referrals of obstructed labor. And these deliveries were naturally with a very high incidence of fetal and maternal mortality. Taking out a deeply stuck head in cesarean section used to be a real challenge. He devised Dr. Patwardhan's technique to overcome the challenge and reduce maternal and fetal morbidity. It was extremely relevant at that time, and even now, although incidence of obstructed labor is now reduced due to low threshold of cesarean section. Thank you.
Thank you, Dr. Medha. That was very nice of you to give the brief look into Dr. Patwardhan's life. And let me tell you that it is a very relevant technique even today, as we will see how ICOG is looking back into it and really reviving it. So thank you so much. And now let's go to Dr. Vaishali Benewale and tell me, Vaishali, what memories do you have of your grandfather?
Thanks, Uday. It's a real pleasure to be here. Dr. B.D. Patwardhan was my maternal grandfather, and we fondly used to call him Bhau. Everyone used to call him Bhau. I remember Bhau as a very generous person. He used to help many poor youngsters financially for their education, then later on to set up their own businesses. So he was basically very generous. He never charged families of teachers because he thought that teaching is a very noble profession, so he should not charge them. I even remember he never used to charge postmen because he thought that they were already underpaid and they are serving a community to quite an extent. So he never used to even charge postmen. When my mother started her own practice, the most important advice I think he gave her was not to deny any medical treatment for financial reasons and not to be money-minded. I think the same advice my mother gave me when I started my own practice. He always believed in women education and women empowerment. When we were children, he used to tell us that how important it is to educate girls so that they will become self-sufficient. We have to understand this because this was an era when girls were not getting many opportunities because of gender bias. And that time, these were his thoughts. He even wanted my grandmother, my Aji, to become a doctor to serve the community. And for that reason, after their marriage, he made her take admission to Xavier's. But unfortunately, because of some family reasons or family incidences, it was not possible and his wish was not fulfilled. Bhau was very particular regarding nutrition of his patients. I think it is so important now. We are considering it is so important. So that time also he was very particular about nutrition of his patients to the extent of rearing cows on his own. So that time we had a cow shed near our house in Girgaon. And I remember going there with my Aji to the cow shed and milking the cows. Now, all patients who were in the hospital used to get home-cooked food, and this was supervised by my grandmother. And Bhau himself used to go and buy all the groceries to make sure that they were of good quality. Bhau himself was a very, very family man. So I will say he was a complete family man. Every year during our summer holidays, we used to go and visit our grandparents, and we used to stay with them during summer vacations. And that time he used to really pamper us. I think he was the happiest person on the earth when he was surrounded by his family and by his friends. So that was how Bhau was for us.
How wonderful, how wonderful. I mean, look at the ideas, having a cow shed so that you can look after the nutrition of your patients. And now today we are relooking at nutrition in this era and saying, oh, now we should be relooking again at nutrition and doing it. And at that time, he thought so much about his patients and he was so compassionate not to charge so many people. So that's absolutely wonderful coming from you, Vaishali. Great memories you have shared with us. I thank you and Dr. Medha very, very much. So it was nice to know Dr. Patwardhan as a person also today through Dr. Medha and Dr. Vaishali. Let's talk a little bit more about the procedure which he did in those times and he invented and he discovered. So the procedure, when we were in Wadia Hospital as residents, we were taught that procedure by our seniors who were assisting us. And it came pretty naturally. And I think it was the easiest thing to do at that particular time when the shoulders are actually coming out of the incision. You very deliberately and slowly deliver the baby by Patwardhan's maneuver. And I think we didn't think too much about it at that time. But has Patwardhan's method found the acceptance it should have? So we go back to Dr. Parag and ask him to give us some Indian data on the Patwardhans. Parag, over to you.
The Patwardhan's maneuver is being practiced for over 6 decades. And I must say that generations of Indian obstetricians have mastered the techniques. They have learned it from their own teachers and are teaching their students as well. There have been a number of papers discussing its advantages and challenges. The paper published in the Jogi in 2005 talks about the operative complications when compared to a control group. And what they found out was the uterine artery injury was more common in the control group, less common in Patwardhan's group. Bladder injury was less noted in the study group, that is Patwardhan's technique. Bleeding was much less. Need of blood transfusion was lesser. None of the patients required hysterectomy, but there was a single case of fracture humerus. This technique has been time and again reviewed by Indian researchers. And this is a study which was published in 2014, talks about how Patwardhan technique is superior and safe in delivery of the fetus in the second stage as compared to the push and the pull technique. Another study from Safdarjung Hospital, Delhi, reviewed this technique in 2016, and they also concluded that the Patwardhan technique needs expertise, but it is safe, has minimal complications if anticipated and done skillfully. It is easy to learn and needs to be more widely publicized and utilized. One more study, which was from the eastern part of the country, mentions that in cases with difficult extraction of the impacted head during cesarean section in the second stage, Patwardhan's technique is useful in reducing feto-maternal morbidity and is preferred method as compared to push and pull methods. Another study from Haryana talks about the advantages. One more study, which was again published from the north, does mention that Patwardhan is a useful maneuver in intraoperative disengagement of fetal head in the second stage cesarean section, and it should be learned and practiced as a primary technique. So Patwardhan's technique was described in 1957, and while reviewing the literature, we found out a similar technique called reverse breech technique, which was described in 1997. Going back to the summary of the Indian studies, which quote that there are less chances of extension of uterine incision, fewer bladder injuries, reduced incidence of postpartum hemorrhage, broad ligament extension leading to hematoma is rare, and lesser need for blood transfusion.
So this was the Indian data on Patwardhan's maneuver. So we Indians find it very easy to do and in generally a thing which is to be taught to all juniors. But is the opinion similar in the West? We will find out in the second part of this episode. Thank you.